Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Jane Weida, a family medical physician and professor with the University Medical Center. And today we're going to talk about shingles. Thanks for joining us today, Dr. Weida. So what can you tell me about the shingles?
Hello there. It's very nice to be here. I would be glad to talk about shingles today. Shingles is caused by reactivation of the chickenpox vaccine in someone's body. So you can't catch shingles from anyone. The only way you can catch shingles is if you've had an infection with chickenpox. And it stays in the body, and then many decades later, it reactivates, and it goes out by one of the what we call peripheral nerves, and it causes a very painful burning rash, and makes people feel really terrible.
Can the shingles come to anyone at any age, or?
The shingles are much more likely to come out after the age of 50 when the risk rises quite rapidly. Yes.
So what can you do to prevent this?
The best way to prevent shingles is to make sure that you had your varicella vaccines when you were young. However, a lot of people didn't have varicella vaccines because they didn't come out until the 1980s. So that means the best way to protect yourself is if you are over 50, you need to get 2 shingles vaccines. The brand name is called Shingles.
So this is why we see older people start having shingles, because it didn't come out until the 80s.
That's absolutely right. It didn't come out until the 80s. That was the varicella vaccine. The first shingles vaccine didn't come out until much later, and it wasn't as effective as the one we have now, and it was actually withdrawn from the market in 2020.
Okay. So what are some of the symptoms you see with shingles?
Shingles tends to start with burning or pain in a certain area of the body, like one little part of the body, maybe in the back, maybe on the face. It starts with burning and pain, and then a few days later, people tend to get a blistery rash. The pain can be quite severe.
Yeah, I was going to say, from my own experience, knowing people who have got diagnosed with shingles, it seems to last a really long time.
It can last a really long time, but what we have found is that we now have things that can, while not prevent it, once you catch it, it can at least make it a little bit better, because we can give people antivirals. If you start them within 72 hours, then you can help prevent, or at least minimize the onset of the pain, and then minimize what we call post-herpetic neuralgia, which is chronic pain that can last for many months and many, many years after you catch shingles.
Does it have any lasting effects?
You can sometimes have the pain lifelong. For instance, I had shingles when I was 26. And every time I talk about it, I get a pain in the same place that I had shingles. It's not debilitating, it's not terrible, but it's there.
Is there any common misconceptions going along with it?
Some people think you can catch shingles from someone else, and actually you can't, but if someone is not immune to chickenpox or varicella, you can catch chickenpox from someone who has shingles. You just can't spread shingles to somebody else. They can't catch shingles from you.
So when should people, I think, is it children, when they need to start taking the vaccine to not get shingles later on?
Exactly. You need a vaccine, varicella vaccine, along with your MMR vaccine, your measles, mumps, and rubella vaccine. You get that about the age of 12 to 15 months, and then you get another one at ages 4 to 6. And that helps protect you against varicella and also against shingles. So that's the first way to do it. The second way is if you're 50 or older, you should get 2 doses of a shingles vaccine, and if you get it earlier, it's more likely to be effective. If you are between 50 and 69, the shingles vaccine is about 97% effective. If you're 70 or older, it's about 91% effective. So it's a very effective vaccine.
I would think if you're older, maybe this is something people forget about to do.
Yes, some people do forget about it, and lots of times I'll remind my patients to get it, and they'll say, oh, I meant to do that. And we actually ask our patients to get it from a pharmacy because it's quite expensive, and the pharmacist can determine right away whether it's covered by the patient's insurance, so that we don't keep it in stock here.
Was there anything I haven't asked about this subject that you would like to add?
I just want to remind people that if they are 50 or older, they really need to get their shingles shots because it's really important to prevent a very painful disease.
Absolutely. Well, thank you so much for joining us today.
My pleasure. Thank you so much for having me.